Welcome to all Allium's partners. Let's talk about stent removal. Just take a quick look at our guide to understand the URS removal flow. Start with looking at the patient file beforehand and go over latest images and work your way up. Here are the instruments we recommend on. Use the largest grasp as jaws you can find. Alligator and rat tooth forceps are the most recommended. In some cases, a dilation balloon could go through strictures that a mechanical dilator wouldn't. We urge you to visually evaluate the stent condition before removal and make sure both ends of the stent are free. This will prevent unnecessary complications and time waste at the OR. In addition, verify if there is narrowing of the ureter distally to the stent. If there is, dilate before stent extraction. A few techniques for monoblock removal. If the stent protrudes 1 centimeter into the bladder, then catch it easily from the side, or if it's 2 centimeters into the kidney and you have an anterograde access, catch it the same way. You can also try to close on it with both jaws if inside the ureter, or catch 2 loops of nitinol at least to avoid unraveling and remove as monoblock. A good technique is catching the upper part of the opening only and leave the lower part open like this. For unraveling, catch only 1 nitinol loop and apply force. If there is some resistance, the stent will most probably unravel. Look at the unraveling secondary mechanism of action. It's engineered this way to grant the tissue an atraumatic removal of the stent. For stent with stones, remove as monoblock, unless there's a stone at the proximal end, then use ultrasound or shockwave lithotripsy. Avoid laser to prevent cutting nitinol and polymer. In radiogenic ureters, dilate distally prior to removal, and with fistulas remove as monoblock and prepare another URS. For stent removal in mid-ureter, use the Urotech forceps shown here in yellow and recommended by Dr. Neymeyer. Verify complete stent removal by checking that the metal loops at both stent edges were retrieved and 3 radiopaque markers in the URS on each side of the stent, plus 1 more on the anchor if there is one. Precision and patient safety are paramount. Implement these steps and tips in your next procedure. By refining your technique, you'll ensure procedural success and improve outcomes.